Greetings, everyone. My name is Lynn Chaikin, the Injury Prevention and Behavioral Health Director at the Association of State and Territorial Health Officials. I would like to welcome you to today's webinar, Essentials for Childhood, How States Can Empower Parents. ASTHO, with support from the National Center of Injury Prevention and Control, is hosting this third in a series of 5 webinars that feature Essentials for Childhood. We're really glad that you all can be with us today. Just briefly, here are the objectives for our webinar today. We want to provide you with an overview of how Essentials for Parenting Toddlers and Preschoolers support safe, stable, nurturing relationships and environments for children. We also hope to provide you with some great examples of how state health departments and their partners can use Essentials for Parenting Toddlers and Preschoolers strategies and other resources to create the context for healthy children and families. And so we're really looking forward to showcasing a number of different speakers. You can see on your screen our agenda. We will first be provided with an overview of Essentials for Parenting Toddlers and Preschoolers by Beverly Fortson from CDC. Then we have 2 state presentations, both on the theme of assuring safe, stable, and nurturing relationships, starting with Serena Rogers in Raina Charles in Massachusetts, and moving to Karen Durasmo in Delaware. So we're really looking forward to providing you with these presentations, a panel discussion, and then we'll be wrapping up for the day. Many agencies, many of your agencies across the U.S. have been on a long journey to empower parents and strengthen communities. And to explore this intersection between ongoing work in states and these new resources available to augment and enhance that good work, we have this exciting panel to offer you today. I just wanted to briefly share some logistics so that you can participate in this program today. So I will be presenting each speaker, and during the course of their presentations, if you have a question at any time, please use the chat feature on your screen to chat in questions for the speaker, and we will, following each speaker, have a brief Q&A where we will field some of your questions, and that will follow each presentation. Then at the end, we will go back to fielding those questions, and we will also keep a log of the types of questions that are asked today. So please don't be shy to use the chat box, and we will again be tracking those questions as we go through our program. So I mentioned that there's a brief Q&A. We have a panel at the end where we get to address some of those questions. And then once our program ends, you'll be directed to an evaluation survey. This is very important to us. Please take a couple of moments to provide us with feedback on our program today, and please be assured that a recording of this webinar, presentations, and any resources mentioned will be shared with participants both as a follow-up email to participants, and then we are developing an archive of all of the Essentials webinars so that you can go back and view any of them. So without further ado, I would like to move ahead and get us started off with our first speaker, who is Dr. Beverly Fortson, and I'll provide a brief introduction for her, and then we'll have her start. So Beverly Fortson is a behavioral scientist in the Research and Evaluation Branch in the Division of Violence Prevention, and has been in this role since September 2008. Her research interests include the primary and secondary prevention of child maltreatment, as well as the utility of interventions for children with trauma exposure and behavior problems. So currently, Beverly is involved in research. This is examining the effectiveness of parenting interventions in preventing child maltreatment. She has also provided clinical services to children and families for about 13 years and is a licensed clinical psychologist. She received her bachelor's degree in psychology from the University of Georgia and her master and doctorate degrees in child clinical psychology from West Virginia University. So with that, I would like to hand it over to Dr. Fortson.
Okay, great. Thanks so much, Lynn. So as Lynn mentioned, I'm going to be talking about the Essentials for Parenting Toddlers and Preschoolers resource that we've recently developed and released at the Centers for Disease Control. In my presentation today, I'm going to talk to you about Essentials for Childhood, which is our broad framework for all of our child maltreatment prevention work. And then I'll talk specifically about the Essentials for Parenting Toddlers and Preschoolers resource and give you information on research that we did in development of this resource, and then more specific information about the materials that are available. So before I go into specifically the Essentials for Parenting Toddlers and Preschoolers resource, I thought it would be helpful to give you some information about our Essentials for Childhood framework and our vision for all children within the Division of Violence Prevention at CDC. Our goal within CDC, our vision for all children, is to assure safe, stable, nurturing relationships and environments for all children. And the image that you see on the screen now is our framework. The framework proposes goals and strategies that communities can consider to promote safe, stable, nurturing relationships and environments. And within this framework, there are 4 goals, and I'm going to go through each of the goals and tell you some of the activities that we have ongoing in each of the different goal areas. If you're interested in getting a copy of the Essentials for Childhood framework, you'll see the web address for that listed there on the bottom of your screen. So the first goal is to raise awareness and commitment. And to do this, we want individuals to adopt the vision of assuring safe, stable, nurturing relationships and environments for every child and preventing child maltreatment. We also want to raise awareness in support of the vision, partner with other people to unite behind the vision. And one of the things that we're trying to do, so we're encouraging states, communities to follow these steps, but we're also trying to keep ourselves accountable and making sure that our work within the Division of Violence Prevention at CDC also goes along with these different goal areas as well. So in this particular goal area, one of the things that we have ongoing currently is the Raising of America initiative, and this is a multimedia public education and engagement initiative that is being developed by California Newsreel to focus on the importance of early childhood for lifelong health and safety. And I think there's going to be a future webinar on this as well. CDC funds are supporting dissemination efforts with this particular project. The second goal is to use data to inform solutions, and here the goal is to build a partnership to gather and synthesize relevant data, to take stock of what data is available, and identify and fill critical data gaps. And then once you have the data, use that data to support other action steps. And within our division, the Adverse Childhood Experiences Study is something that we're using and encouraging states and communities to use to collect and analyze information about their populations of interest, the individuals in their communities, and translate that data to inform prevention efforts. The third goal is to create the context for healthy children and families through norms change and programs. And this is primarily what we're going to be focused on today in today's webinar. So we want to promote the community norm that we all share responsibility for the well-being of children, promote positive community norms about parenting programs and acceptable parenting behaviors, and make sure when we're implementing programs that we're implementing evidence-based programs for parents and caregivers. And this is where we see our Essentials for Parenting Toddlers and Preschoolers resource fitting in. The fourth goal is to create the context for healthy children and families through policies. And here the goal is to identify and assess which policies positively impact the lives of children and families, and make sure we're providing decision makers and community leaders with information on the benefits of evidence-based strategies and rigorous evaluation. We have a couple of things that are going to be coming out in the near future that help with this particular goal, a policy paper that looks at policies related to child maltreatment and particularly effects on child maltreatment, and then also another project examining implementation of TANF policies in a state in the U.S. So moving now on to our Essentials for Parenting Toddlers and Preschoolers resource. Going into this, we did a lot of formative research. We took a look at what was included in the data out there that other people had already done, and then we also collected parenting information from 2 sources ourselves. We collected information from Porter Novelli's Health Style Survey, so we included 6 questions that assess attitudes and beliefs about parenting, and we also conducted focus groups in New York and Los Angeles. One of the things that we learned from this research is that parents are actively seeking parenting information. So over 2/3 of our sample said, yes, I'm a parent, or all of the people that we looked at the data at were parents, and then of those, over 2/3 of them were actively seeking parenting information, suggesting to us that they, like which we knew already, not all parents have the answers that they need, so they're looking for information. We also learned that parents are open to learning new information. They're very confident in their abilities to learn new parenting strategies. When we took a look at some of the initial literature on parenting, we saw that parents often want to do things differently than how they were parented themselves, and so they're open to learning new parenting strategies. We also asked parents the age groups that they want to have the most information about or that they need more information about. And by and large, people said all ages, but we asked specifically, okay, which 2 ages or which age do you need the most information about? And adolescents and toddlers come in pretty close there as the 2 top ages that people want the most information about. Parents also expressed a high level of interest in the topics that are typically included in behavioral parent training programs: how to talk and communicate, build good relationship, set good rules and expectations, increase good behavior, decrease bad behavior. This was promising for us because the information that we have, at least the evidence base, is on these particular topics, and they're things that parents are interested in learning about. We also asked parents who they trust as sources of parenting information. So when you have a question, who are you going to go to with that question, and who are you going to trust to provide you good, decent information? So parents, friends, or other people with children were included at the top of that list, and over half of people said that's who they trust most. Medical professionals, medical organizations, religious leaders, and teachers were also included on that list. We also ask parents how they prefer to search for information, because one of the things, if you take a look at the slides that I showed previously on the topics that we asked parents were they interested in, this is not how parents are typically looking for information. They have a problem and they want to know the answer to the problem. So they're not looking for these general parenting strategies. They're looking for, how do I deal with a tantrum in public, or how do I deal with some other problem that I'm having? When parents are looking for information, they want to get answers to the questions quickly, and they often want real experts providing the answers to their questions. And so these were all things that we think were important to consider in development of our resource. We also asked parents what their preferred methods were for receiving parenting information. Magazines, newspapers, videos, DVDs, internet, web-based sources were all included as top methods for receiving parenting information. So now, more specific information about the Essentials for Parenting Toddlers and Preschoolers resource. We'll first start off and show you a brief overview of the resource.
Parenting. We all want our children to be safe, loved, and well-behaved. But sometimes it can be hard. Essentials for Parenting can help. CDC's Essentials for Parenting connects you with decades of parenting research and experience. Many tools will help you understand and apply this information, including online activities, reading materials, and videos. Essentials for Parenting will help you create caring relationships with your children and find solutions to
of the Essentials for Parenting Toddlers and Preschoolers resource. We base this upon the best available science. As I mentioned before, we ask parents if they're interested in learning about the topics that are included in the behavioral parent training programs. And so what we did was take the information that's included in those programs and include it in this particular resource. So it's based upon what we've learned over the last 30 years from the evidence-based behavioral parent training literature, including programs like Triple P, Parent-Child Interaction Therapy, and Incredible Years. We do know that this resource, unlike many of those others, can be used at no cost. We know that those other programs that I mentioned previously are very often costly to disseminate on a wide scale due to the training that's required for providers, the purchase of materials or equipment, and extensive face-to-face contact that is needed with parents. And so we think this is a benefit of the resource. It's also capable of reaching broad audiences. So one of the limitations of the behavioral parent training programs that are out there that we have access to is those programs are very often to get out to people on a large scale. So this particular resource has the potential for a wider reach than individual parenting programs. And we also base it on the types of information parents are looking for and where and how they're looking for information. And so we used much of what we learned in those initial focus groups and data assessments to really develop a resource that parents would find useful. We have tried to deliver the content in very engaging ways, so making sure we include video, demonstration of skills, allow parents an opportunity to engage in activities that teach and reinforce positive parenting skills. And also we, as I mentioned before, we carefully developed this based on what we learned from our previous work. It's for parents with toddlers and preschoolers. It's hosted by CDC, and I'll give you the web address in a few moments if you've not heard of it by now. And as I mentioned, it includes a variety of content, written content, videos, as well as interactive activities. When possible, we provide the rationale and benefits for skills as well as steps on how to use the skills when that's appropriate. And as you'll see in the screen there, in one case where this is true, the rationale for why family rules are important is included there, and then information on why family rules are important, and then steps for creating family rules are also included. There are 5 topic areas, and this is the one place where we did not go along with the way that parents said they wanted to get information. We included the topic areas that you saw earlier that are typically included in behavioral parent training programs. And the reason that we did this was because as we started trying to list out all of the problems that parents have that they're looking for answers for, it became really large and really difficult to organize. And so what we've tried to do in response to that is we have the information listed, as you see there, by the topic areas, but then we also have a frequently asked questions section of the website so that when parents are looking for answers to their questions, they're going to be directed to the answer there on that particular website, and then it'll also direct them back to other information about that topic area and then other topic areas to hopefully prevent future behavior problems. There are a variety of interactive activities, and I'm going to show you some examples of what some of those look like as well. So the first is the scenario question and activity example. And what you'll see in this particular case is you have a few words that set up the scenario, and then there's a video that would play out if you were able to click on that. And then parents were asked, what would you do? And if in this particular case, if they clicked on A, you would see that the A turns red, and there's a bit of an explanation there about why that's not the best choice, and encouraging parents to try a different choice. If they click on the C in that particular case, it turns green. That means that's a good choice, and provides information about why that's a good choice to select. There's also a picture scenario, and in this case, we only have one of these at present, but parents are prompted, what is wrong with this timeout space? And as you look around, there are many things that could be pointed out that are probably not the most optimal in this particular case. But if you click on the bookshelf, and you'll notice that the timeout chair is right beside the bookshelf there. So if you click on the bookshelf, you'll have an explanation there about why that is not the best thing to include there. So your child may be tempted to climb on shelves, grab things, so keep the timeout chair away from shelves or other furniture. If you click on the TV, you'll also get an explanation of why it's not good to have the TV on in the timeout space. And then an example of a better timeout space. There's also a video question and activity that's included, and I'm going to skip the example for this just for the sake of time. But if you were to click on this particular video, what you would see is that parents are missing opportunities to use some of the skills with their children. So in the case in what you see here on this screenshot, this parent is playing with this child, and she's playing very appropriately with the child, but she's just directing the child to do what she wants to do as opposed to playing what he wants to play. And sometimes it's appropriate to teach as she's teaching there, but sometimes it's also appropriate to play what the child wants to play. And so just missing some opportunities to engage with the child on their level. There are videos and vignettes for all 5 topics. They incorporate humor, particularly the videos. They're designed to engage, educate, and motivate the audience and really increase interest. And the video and the vignette all include subject matter experts, parents, and children. I'm going to show you just a few minutes of the video and the vignette so that we have time for the other speakers, just so that you have an idea of what they look like.
Every day I try to spend some really quality time with Jenny. You know, talking and sharing. Time that we can relax and just really enjoy each other's company. And make a special effort so that it's really Jenny time. She always decides what we play. I'm basically just along for the ride. Although I do have to help her out sometimes, just to get things started. And who's this?
This is a princess.
A princess? Wow. That means she's in charge. Huh? Of the whole fairy nation. The buck stops here. She's the one we all want to bow down to and try to make happy. Sort of like a CEO. That's it. And she's like a fairyland CEO. She'll probably need a classic functional organizational structure where each portion of the organization is grouped according to its purpose. Which means she'll need a strong financial officer, or maybe even a creative director. And let's not forget about operations, huh? Somebody needs to keep the wheels of fairyland turning. And who is this? This gives us a chance to just be Dad and Jenny. And she's so creative. You just never know what's going to come out of her mouth.
He's from HR.
That's right, Jenny. He's head of HR, Human Resources for Fairyland. And how do we know this? No briefcase. Folks from HR are so busy putting out fires, they rarely carry a briefcase. Unless it's a board meeting or some client consultation, which I don't think is the case here. So, Jenny always used to be excited when I played dolls with her. I don't know what happened. Is there anything I can do to get her excited about playtime again?
One of the most important components of playing effectively with your child is letting your child take the lead in terms of determining what they're interested in.
So I think I'm going to stop the video there because I think you have an idea of what's happening. All these videos are available on our website, so you're free to go and have a look at them. But what happens in these videos is you have a parent who comes on and they have a problem. They're working to resolve the problem. You have experts who come on with different parenting advice. And then at the end of the video, you'll see that the parent has resolved their issue. In this particular case, he's communicating with his child better, playing more appropriately, not talking about things that are way above her head, and just really enjoying the time that he has to play with her. The other type of video that we've included, because one of the things that we learned in our focus groups is that not all parents are interested in watching videos like that. There are some parents who just want to know the information quickly. What do I need to do? Tell me what I need to do fast. And so in this particular case, we created vignettes that are complements to each of the videos. And I'll play a few minutes of this so that you can see what it's like.
Positive communication with our children helps them develop in a healthy way and strengthens our bond with them.
Parents can really kind of tune into what their kids are saying to kind of build those communication skills, help their children build language skills by saying, you know, what did you say, and repeating back what the kids said and reflecting on that emotion that kids are expressing.
There are 4 steps for communicating positively with your child. Step 1, praise. Use praise to help your child know.
And as you can see, it'll go into each of the different steps that are included there. So in this one, you have a narrator that provides the information, provides specific skills that are important for communicating with one's child. In terms of future activities, as I mentioned, the site is now available. It was available as of May 19th, so it's a relatively new project that we have. We're doing an evaluation of the efficacy and feasibility that's slated to begin in the fall. We do have what we call a Go Kit that includes sample web text that partners can use in communicating about the resource, sample outreach text. We have web badges with codes, social media messages that can be used. We have promotional documents, video links if you want to embed them in your own resources. You're welcome to take our pages and syndicate them on your own pages, so use our content for your own pages. There are instructions on how to syndicate that, as well as ideas for customization. We also have developed a digital press kit. The Go Kit is available currently. The press kit is still in the making, but will be available soon. And then have other media outreach activities planned over the coming year. And I will stop it there.
Thank you so much, and I'm really glad we got a chance to see some of the video clips. I apologize for my interruption. What I wanted to note to participants and for our presenters today is that there's already a really rich discussion starting to emerge in our chat feature. Folks are already responding to what you're presenting in terms of perspectives on timeout, other resources that are being utilized, other things being utilized in the field, and even folks starting to put together some ideas about ways to apply this information. For example, one of our participants was wondering already about creating online courses using this information. For example, WIC is using online courses for nutrition education, and how it would be great to offer these as an option. And I just see that somebody just chatted in. So Dr. Fortson, if you might just reiterate, just if you could say a little bit briefly again about the evidence base behind the essentials, and then we can transition to our next speakers.
Sure. So we base this on the evidence-based behavioral parent training programs that are out there. Triple P, parent-child interaction therapy, those evidence-based programs that have some evidence for preventing child maltreatment. One of the things that we are doing is we're going to be evaluating this for its own evidence base to see if it does, in fact, have the same effects on parenting that those original programs had. So we didn't change the content. We're changing the medium at this point. So we are hopeful that this medium will still lead to some of the same positive outcomes that we saw previously, but we're going to be evaluating that coming up soon.
Thank you, and thanks for that presentation. As more questions come in, we'll attempt to field some of them at our closeout panel Q&A. So I will now be moving to our next speakers who come to us from Massachusetts, and they are Serena Rogers and Raina Charles. So I'll give you a brief introduction and then let them begin. Serena Rogers is the Director of Home Visiting and Associate Director of Programs at the Massachusetts Children's Trust. Since 1997, she has coordinated the accredited Healthy Families Massachusetts Home Visiting Program, a system of 25 programs covering all 351 cities and towns in Massachusetts, and the Children's Trust Healthy Families Implementation Team that provides program and policy development, contract management, technical assistance, and quality assurance to ensure model fidelity and best practices on the program model. And she's also joined by Raina Charles. She is the parenting website manager for OneToughJob.org and has worked at Children's Trust since December of 2000. Previously, Raina worked as the Healthy Families Massachusetts training coordinator and was responsible for the development, implementation, and evaluation of the Healthy Families Massachusetts training program. Raina has written and facilitated multiple workshops in various family support topics such as family assessment, cultural competence, supporting goal achievement, ages and stages questionnaire, and more. And so with that, I'd like to turn it over to Serena Rogers and Raina Charles.
Thank you, Lynn. Good afternoon. This is Serena Rogers, and I'm going to open up our presentation, I will tell you all a little bit about the Massachusetts Children's Trust, and then Raina will continue and talk with you a little bit about our One Tough Job Parenting website, and then I'll join you again to talk about some additional steps that we are taking in Massachusetts that we think are kind of exciting. So just briefly about the Massachusetts Children's Trust. We are typically called the Children's Trust Fund for the state of Massachusetts. We are a state agency, so we were created by statute, though, and we do have a board that helps to guide our work, which is a little different than other state agencies in the Commonwealth. And what's also unique about our board is that it is composed of every commissioner whose agency serves children and families, and it also has specific spots on our board for representatives from different sectors of the community. So it might be judicial, media, medical. They all participate on our board and help to guide our work. We have a 501c3 in addition to that, so it allows us some flexibility in being able to get private dollars both from foundations and individual donors. We are also the community-based child abuse prevention grantee for Massachusetts, so we have the federal dollars flowing into the Children's Trust as well. So we've got both state, federal, and private funds, which affords us a lot of flexibility and opportunity to do some creative things that we've been able to do. We do fund, develop, and evaluate education and support programs such as home visiting, family centers, and online resources for parents. The Children's Trust was founded in 1988. We launched our statewide Healthy Families program for first-time parents age 20 or under in 1997. And we hope you enjoy the beautiful orange and yellow that we have going on because we rebranded as an organization last year. So this is our new look. Let me advance that slide. And, okay. Well, my slide's not advancing. I'm not sure why. Well, no, I went too far. Okay, sorry about that. But mostly, one of the guiding principles for the Children's Trust are that relationships are primary, especially for children, that every child deserves to grow up in a nurturing and loving family, that every parent wants to raise their children in a responsible and loving manner, that every family has strengths, and that every community strives to be a place where all children and families thrive. And we believe that we can empower parents to accomplish these goals by providing information, skills, and support so that they can create safe, stable, nurturing relationships and environments for their children. One of the ways that we are doing that is by launching our One Tough Job website. And this is just a quick look at what our One Tough Job website looks like. I will let Raina tell you a little bit more about One Tough Job.
Hello. So thank you. We had a little technical difficulty here. I'm going to talk a little bit about One Tough Job and what we'll be doing and some lessons that we've learned and also looking forward, steps forward. So just a quick background, onetoughjob.org was launched in 2006. It's available in both English and Spanish. We have around 500,000 visitors per year, and that's around the world. And our goal for our site has always been to provide parents with information, tips, and support so that they can create the safe, stable, and nurturing homes for their families. And we really do believe that the best way to do this is to use a strengths-based normalizing approach, much as we do within our own sort of face-to-face home visiting and parenting education support programs. We see One Tough Job as an extension of those philosophies, and so we write articles specifically with those philosophies in mind. And the next slide gives you some examples. I don't know how small you guys can see it on your end, but it's really a balance between content that we know appeals to parents and our own goals and philosophies. So one of the articles that we worked on, for example, was 5 ways to keep your family happy and strong, which is what we did was we took the 5 protective factors from the Center for the Study of Social Policy, and we turned it into something that would be digestible to parents, because clearly sort of going through the research is not something that's always particularly pleasant for every parent. We also do things like have articles on activities to do with your preschooler, which are very popular, and sort of a blended, the importance of family support, which is something that is both appealing to parents and also part of our content and how we believe that all parents need support, all parents need help at some point, irregardless of the social, economic situation, that we all need a little help when it comes to parenting. So I'm going to talk a little bit about sort of over time the changes that we've made to our site. And so we have looked at our site. I came on board in 2012, and what we noticed is that while we were getting a fair amount of visitors, we weren't getting as many from Massachusetts as we would like. We are a Massachusetts-based organization, and while it's great that we were reaching, people all the way in Argentina and in Sri Lanka, we really wanted to focus on how can we get parents in Massachusetts to use our site. We did a series of 6 focus groups in 2011 at family centers across our state, and they gave us some feedback on how they liked the tone of our site and the content, but that, sometimes some of the materials could focus more on first-time parents and may have lacked depth. So we made some changes based upon that feedback. As we've moved through time, a lot has changed in the world since 2006 as far as what a website looks like. And so we started to look at redesigning our One Tough Job site from a technical and visual aspect, but we decided to really take a step back and look at, okay, are we reaching the right audience? Are we able to get the message out to the parents that need the information? So we applied for and received a grant from a group called the Community Consultant Teams in Boston, and they're a group of MBA graduates and professionals who volunteer their time to really work with nonprofits to look at their communications, their marketing, sort of the skills that don't always necessarily exist in a nonprofit or a state agency, and help set up strategic plans on how to maximize those resources. So CCT, Community Consultant Teams, came in, and they gave us a lot of information. The CDC was nice enough to share their Essentials for Parenting Toddlers and Preschoolers research, and so we used some of that to inform our decisions on where we're going to go forward with One Tough Job. So I'm just going to talk a little bit about lessons learned from sort of all of those processes I just mentioned. There is definitely stiff competition in the online parenting world. I think, everybody's probably familiar with the Babbel, which is owned by Disney, Parenting, Parents.com. These sites employ multiple editors and tactics to engage and keep parents, and they're, essentially they're advertisements. So they have the money behind them from very big corporations to do that, and that's something that online resources are competing with. With that being said, there's still a need for high-quality resources. Many of these sites are if you go on them, they're overpowered by the number of advertisements that you get before you can actually get to quality information. And some of the information itself, in some sites can be sketchy. So there is still that need. For us in the CCT process, our site we launched from all ages of kids, which was great information to have, but it was very clear that in order for us to be most effective, we had to really look at and identify a target audience. So for redesign, currently right now we're going through the process of revising our content. We're going to focus on kids in parents and families in Massachusetts with kids 0 to 6, and that also translates well to our programs and gives us a sort of built-in audience for that. Finally, I think the last one's going to come as no surprise, that social media is an increasingly relevant way to connect to parents and collaborate to other organizations. We had a presence with our Children's Trust for Kids account, but we didn't have a specific presence for One Tough Job, and so that was something that was launched earlier this year. So just a little bit more on sort of social media. Besides really engaging to parents, so One Tough Job social media is really for parents and parents' interests only, as opposed to our Trust for Kids social media, which focuses on all of our audiences, could be legislators, others, programs. And along with really connecting with parents, what we found is that it's a really great way to connect with other state agencies and nonprofits and even relevant for-profits in our state. they're likely to sort of retweet and share content and like. And, rather than sort of, we have these big collaborative meetings with other initiatives that we do, and those are definitely certainly needed. But it's interesting to see how many of the state agencies and other nonprofits has really signed on to our social media without a lot of, coaching or sort of, huge work on our end. I think everybody's trying to do the best practices on social media. And with that in mind, we have a communications coordinator, Eli Beckerman, who does all of our social media. Him and I started to present on best practices for social media and family support starting in our annual conference 2 years ago. And what we found was that there was really a need for a community of practice of those professionals. Again, people who are working in family support, serving agencies, organizations that really want to talk about, hey, what is Facebook? How can I use it? How do I use Twitter? And some of the other sort of, more in-depth, how can we engage parents? When don't we want to engage parents through? How do we teach parents how to use social media? So it's been a wealth of information. Quickly, I just kind of wanted to go through a campaign that I think we launched here over the summer. Not Even for a Minute is a campaign to make parents aware of not leaving their children alone in the car at any minute. And every year we've done this campaign, but particularly this year we had a relaunch with our new materials. We also were able to collaborate with many other agencies and organizations, state agencies, and some of this was due in part to also our social media presence. So we were able to, here's just an example of some of our partners. Department of Transportation, they became a big partner, and again, with very, very sort of minimal work on our end, we asked, they said yes, we sent them over some materials. Right now, Not Even for a Minute is on 34,000 impressions across the state from Boston to Chicopee, and they're on the electronic billboards, they're in the RMVs, they're also on the toll statements of everyone in Massachusetts who receives one of those. So they came on again with sort of minimal sort of couching by us. They were only too happy to do that. We also have the Retailers Associations of America, some of the Dunkin' Donuts across the state, Early Education and Care, the Hospital Association, Food Association, which is great. Both of those, grocery stores, is a great place that we could get this campaign out to. And the Fabric Care Association, which was interesting but awesome, dry cleaners. So having a poster and a flyer for families who are coming to pick up their dry cleaning about this public awareness campaign. So sort of lastly, before I turn it over to Sarita, right now we're working on content again and the design of the new site. It will still be onetoughjob.org. We expect to launch that in spring of 2015. We're also working in engaging programs and in reaching, parents. And this is something that One Tough Job we've used throughout. Programs have been there, have used this as a resource with families, but we're looking to engage people in a greater way when it comes to blog and discussion boards on our news site. So we'll continue to do that. And finally, we're going to continue our statewide social media community of practice. It's been something that has been very helpful for our learning process, and I think has been helpful for some of the organizations who are part of it. Turn it back to Serena.
So just a couple of extra items that we're doing. Part of what we're very excited about here in Massachusetts is our ability to now take what we know about electronic resources, and as Rena and both Dr. Fortson have mentioned, we know that this is a way that many parents are getting their information. They want something fast. They want to be able to see it quickly. They want it to be engaging and interactive, and that includes, parents in all types of programs that we have. And one of the ways that we're helping our home visiting staff to take these resources, because there are a lot of great resources that are now developed that parents can use that aren't covered with a lot of ads and have a lot of great information is online. And so we deployed tablets to all of our home visitors who were funded through McV programs this year. This way the home visitors have the tablet with them. We actually have our local Department of our Executive Office of Education, the IT department was very interested in being on the forefront of getting tablet computers out into the field in the hands of direct service sites. So they have agreed to pay for the MiFi devices that go along with them, so that all the home visitors now have a tablet and a MiFi that they can then take into the homes of parents that are receiving home visiting, regardless of where they are. So in, remote Western Mass or, right downtown Boston, and they know that they will have a Wi-Fi connection. And then they can do things like Access, One Tough Job, or any of the other websites, or like Essential for Parenting, and be able to use them right in the moment with families. If families have a question, they can pull something up. There might be some great curricular item from, say, the 0 to 3 website that they could be able to access as well. So we're really excited about having the resources to take advantage of the wealth of information that's out there online, that's good quality information for parents, and in a way that parents are kind of getting more used to accessing services or accessing information. I apologize for that. We are also at Essentials for Childhood Initiative state. When Dr. Fortson was talking about Essentials for Childhood, there were grants for some states, and we are fortunate to be one of them. And part of what made this very exciting for us in Massachusetts is that the focus is on identifying and aligning already existing resources for families to support safe, stable, nurturing relationships and environments for children, as well as identifying gaps in services and then creating messaging on strengthening families. And probably what we should have said is that sort of shifting of social norms around parenting is one of the reasons why One Tough Job is even named the way it is. That, most parents don't get told before their parents that parenting is really one tough job, and we wanted to use that as a way of signaling it's okay to admit as a parent that parenting is really hard. It is one tough job, and we're hoping that parents can find both humor and affirmation in that, and that's another tool that we're hoping to use to build on in our Essentials for Childhood initiative here in Massachusetts. And that's all the information we have for you today. Lynn?
Yes, thank you. I think that's wonderful. We're talking today about this webinar explaining how to use resources, creating a context and an environment of support. I think that you've given us many amazing examples of all the avenues that you're using in Massachusetts, some of them via technology. And I think that there were a couple questions that have been asked but also answered. And again, I direct people to track the chat conversation that's occurring because there's some really good information arising there. We had someone who was asking about, well, what about smartphones? Parents really, how do we make this available via smartphone? And Beverly Fortson was sharing that currently a fifth of CDC's users of the Essentials for Parenting website, they're using mobile phones, and that there are videos available on YouTube. And so that there are mechanisms to be able to get this information out there to parents in all of these different platforms. And so if people have additional questions about the work in Massachusetts, please continue to chat those in. And as we transition to our next presenter, we will have some time at the end of our program to go back and look through and make sure that we can address as many of your questions for one or all of the panelists who are presenting today. So with that, I want to thank you again for the group presentation. I'd like to move us to Delaware. And our next speaker is Karen Durasmo. Karen has been the Executive Director of Prevent Child Abuse Delaware since 1998. Within her agency, she is responsible for planning, fiscal management, board relations, and represents the organization through her membership on state and national committees. At this time, Ms. Durasmo is the convener of the Family Support Coordinating Council and the Stewards of Children Steering Committee. She also serves on Delaware's Early Learning Council, Home Visiting Community Advisory Board, Help Me Grow Advisory Council, and the Delaware Readiness Team's Advisory Committee. So we look forward to hearing what you have to share with us from Delaware. Please go right ahead, Karen.
Thank you, Lynn. Today I wanted to share a brief description of what Lynn referenced before as the long journey to empower families and communities in Delaware. This has been a process that has taken many years. We are very fortunate here. Delaware is a very small state. We only have 3 counties and a population of around 900,000 people. And so when we look at issues like this, quite often we are looking at them in collaboration with many partners at a statewide level. And so we're often told, you know, well, this should work in Delaware because there are so few people. And we take that seriously and try very hard to use our own ability to work with others closely to create some thoughts at perhaps a broader level, and that's what I was going to share with you today. This is really about Delaware's attempt to determine how best to work together to strengthen and support the families in our state so that we can assure safe and stable and nurturing relationships for every child and to prevent child maltreatment. And I really think that we backed into that as our inquiry. Now it seems very clear to us that that's what we're doing. But we had a process that we had to go through in order to become clear about the types of questions that we were asking. The work with families that we were observing when we began this process helped us to realize that the responsibility for working with families is really split among several state agencies, including our Department of Children, Youth, and their Families, the Department of Education, and our Department of Health and Human Services. So there actually was very little ownership and no real formal structure of a systematic way of looking at helping to strengthen families and to make sure that communities could do a great job of providing resources and tools that families needed. There is a very strong emphasis in our state right now on quality early care and education, and we pulled back from that a little bit about a year ago and realized that we want to make parents better, not less relevant in the lives of their children. I don't think that that's what we intended when we started out utilizing support. We got $22 million from our governor and then an early learning challenge grant from the federal government to really look at how to create a quality early care and education system. But what was happening was that the scales had tipped so far in that direction that we were not really attending to what we could do to really provide supports and resources to families. And so we wanted to re-emphasize the importance, I think, of that activity. And so we started talking about the fact that family engagement is really essential to an effective and sustainable early childhood system, and that programs with strong positive outcomes like Perry Preschool have a significant parenting component. And so we could really not hope to create the quality early care and education system that we had set out to achieve without really looking at what are we also doing to assure that communities can help families to do a great job of raising their kids. So we started to think about the fact that building parenting skills is far more successful than attempting to compensate for weak parenting. Just having wonderful, high-quality child care would not be enough to overcome a lack of positive, stable, nurturing relationships in the home. So one of the things that we did, we started thinking about the system that we have here in Delaware, and there actually are many additional things that go on this particular piece of information, but I didn't want to overwhelm everybody with just a lot of words. What we did was we started thinking about this in terms of who, what, where, when, why, and how. And so we thought about what is it that we want to do, and we came up with our answer. We want to assure that safe, stable, nurturing relationships are available for all of Delaware's children. And so then we said, well, why? Why is that something that is important to us? And I think certainly we all know the answer to that question. But we wanted to really emphasize and make sure that we kept looping back to the fact that the family really is the most important factor in a child's development, and the community within which they live has so much to do with how that family is able to function. And so we wanted to keep looping that back into our cycle of thinking so that we would continue to remind ourselves that we had to be on a parallel track, that while we were building quality early care and educational experiences, we also were doing a great job with family engagement, support, and strengthening. And you can see on this particular model, we talked about the fact that we wanted to look at the research, and so the Family Support Coordinating Committee did indeed go back to some of those studies that were done, the Preschool and the work that was done by Richard Reeves and James Heckman. We went back to those and read them and discussed them as a group so that we would really have a common way of thinking about the importance of families in the lives of their children and what it was that we wanted to accomplish. And we definitely, recognize the need to connect services to research. We talked to some folks from the University of Delaware about implementation science, the fact that at this point we really were looking at trauma-informed services, the results of the ACE study, and some of the information that we now have, the data about how many people in Delaware are experiencing ACE scores and what those scores are. We also, of course, were looking at toxic stress, the 6 protective factors, essentials for childhood, which is what we're talking about today, and always thinking about being culturally appropriate. And so there were tasks that came out of this conversation, and you can see down at the bottom that we also were in the process of determining who were our partners within the state who could help to provide the actual services that might be needed. At the very bottom of the page, we have a continuum that we had created, and in thinking about this, I actually have started to think about the fact that this is not so much a continuum which is linear, but it's a circular continuum, that at different times in our own experience as parents and families, we may be a low-need family or we may be a high-need family or anywhere along that continuum. And so we've really tried to think about what is it that we are trying to do when we're reaching out to families that makes sense for them where they are. So that could be as simple a question as, I have a 2-year-old that's ready, who's ready to start going to preschool, and I really want to know about, helping with that transition, through to people who have some much more serious concerns, perhaps, about their children's behaviors. And so we really started to put this all together in a way that helped us to systematize the thinking that is going on amongst all of our partners. And so we began to determine that, there were certain priorities that would really direct the work of the different groups that are involved. And so we think, we absolutely understand the need to connect services to research and to investigate implementation science as a way to make sure that we're implementing our evidence-based programs with fidelity. Again, services provided are research and evidence-based, and that evaluation is built into the process. One of the things that Prevent Child Abuse Delaware does is that we serve as the lead agency for the CB CAP dollars that come to Delaware from the federal government. and we're very fortunate that we have somebody working on evaluation. And she has actually developed an evaluation that looks at how well programs are building the 6 protective factors. And we hold all of our programs that are funded by CBCAP dollars and now are expanding that to really think about, how well are we doing against those benchmarks. We obviously wanted to create concrete steps to develop the essentials for childhood, both at the community level and at a more familial level, and to create a culture where family engagement, support, and strengthening is normalized. And this really became key for us because we kept having conversations, and they would constantly be going off in the direction of, well, what about kids with special medical needs? And what about, really reaching out to high-risk populations? And we kept having to really pull ourselves back and think about this, desire that we have to assure that we are, and you can see that here, promote positive community norms about parenting programs and emphasize that learning effective parenting skills is a process and every caregiver can use help at times. We wanted very much to be able to reach out to all parents, as I said, along that continuum, which is actually, I believe, a circle, so that when there was a need that would develop, a parent or a family member or a caregiver would know what resource they could reach out to that would be able to provide them with the resource and information that they needed. One of the other challenges that we faced was that we had been having a conversation for a long time, and we realized that we really needed to move our activities from aspirational to operational. And so we, with the help of the Essentials for Childhood framework, I think that we have been able to move forward in our thinking and also to have some ways in which to reach out to a more general population of parents. We definitely, as I said before, want to create a culture where family engagement, support, and strengthening are normalized, not stigmatized, so that we don't have people afraid to ask a question or concerned that the things that they may wonder about when they're trying to do the tough job of parenting, that they're willing to come forward, that they know that there are resources available for them, and that they utilize those resources. One of the things that we have been doing in the state is bringing all of this information together so that it can be more easily accessed by people who may need it. And there's a wonderful website that has been created through the auspices of public health called Delaware Thrives. And that website includes information about our home visiting programs, about Help Me Grow, Safe Sleep, and QT30. So let me back up for just a minute and talk a little bit about Help Me Grow and QT30. Help Me Grow is part of the national movement that has been going on, where a single place has been created where families can receive assistance with locating resources that they require. We have a wonderful parent of a child with special needs in Delaware who describes Help Me Grow as the person who helps you to find the things you need at the Home Depot, because the Home Depot is so big that you have no idea sometimes where to go to find what you need to fix your sink, and so you need some assistance. And that's what Help Me Grow provides for folks who may realize that they have an issue which requires some form of help from an outside provider, and they don't really know where to go to get that help. And so Help Me Grow is an information and referral line, but it actually also contains an element of reach out and touch someone, if you were. The people who answer the phones for Help Me Grow are trained and have the ability to walk people through a productive conversation, and then they follow up with them after they have provided a referral to make sure that the needs of the family have actually been met. The other thing that I really wanted to talk about was QT30. QT30 is something that we worked on because we wanted to create a way of reaching out to a general population of people with some tip that would allow parents to really establish a positive connection with their children. And we wanted it to be something that could be done by all parents and that would be easily understood by them. And so QT30 is a campaign that was designed, and if I flip to the next slide, you can see some of the graphics that have been created. QT30 stands for Quality Time 30 Minutes a Day. And so this was our basic message to families, that really one of the greatest investments that you can make in your children and that you can make in your role as a parent is to spend 30 minutes of quality time with your child every day. And this is brand new. We've been talking about this for a while. We had an ad agency work with us on this. There are now booklets that go along that provide suggested activities, which take about 30 minutes. But we really wanted to use this message to help to get across, one, the fact that early childhood and all of childhood really is incredibly important in terms of establishing a foundation for children, and two, that your interaction with your children and the way that you can really help them isn't difficult, and it isn't something that's outside of the realm of possibility for you. I have a good friend who always used to tell his pizza delivery young man that the best thing he could do with his small child was to read to her. Just read a book every single day. That's one, of the best ways to make a connection. And, of course, we know also to enhance language and all of those other great things. But I think sometimes in our culture we set up parenting as something that is outside of the realm of what we would normally consider, our activities to be. And people are busy, so we got this back down to a basic message. Quality time, 30 minutes a day. This is the investment that you can make in your children. And I think this really goes a long way towards thinking about what is it that we need to do and can do to assure that, everybody has a role to play in raising great kids. You can spend 30 minutes a day with your grandchildren, with your niece or nephew, with the neighbor child down the street, reading a story, talking about their day. And so, again, really thinking about normalizing rather than stigmatizing the information that's available and the ways in which families can become even better at helping their children. Another one of our current activities, and something that we've really taken seriously and have recently been looking at, is to utilize our Delaware readiness teams, which were created through our Early Learning Challenge, to help create a better transition between pre-K and kindergarten. Well, these Delaware readiness teams have expanded their focus, and they're now thinking about, well, what is it that communities and families can do to make sure that children are ready for life? And so we are in the process of bringing the community cafe model that was developed by the Children's Trust Fund to Delaware, so that we can have enhanced conversations with our teams and really talk about what are some of the things that are needed and possible in terms of creating ready kids. And so in both cases, we believe that the Essentials for Parenting Toddlers and Preschoolers are absolutely perfect pieces of information that we can provide either through a connection to QT30, where parents are coming and they're getting information about that quality time, and that they can also then have information provided to them through the Essentials for Parenting Toddlers and Preschoolers. So creating a space within Delaware Thrives for this information, and then really thinking about, in terms of engaging families, talking to them about how best to utilize this information and to get it out there into communities. One of the things that we are doing with QT30 is that there's going to be a pilot, and the books that support this particular campaign are going to be distributed to people throughout the state. And it'll be interesting to see, I think, how people feel about this information and whether or not they actually begin to share some of these ideas with their neighbors and their friends. So we are continuing in our process. As you can imagine, working at a statewide level is both challenging but also extremely gratifying. And we are looking forward to utilizing the Essentials materials as we continue to go forward, really reaching out and helping to assure that people realize that, you know, this is really about all of us doing a great job of raising our kids, and that, you know, all of us at one time or another may have a question or a concern or something that you know, allows the need for us to have some additional information. So, you know, really thinking about the fact that every caregiver can use help at times, and that it's not stigmatizing to need assistance to be a really great parent. So that's what I have for right now, Lynn, and I know you wanted to get to the place where we could ask some questions.
Thank you, Karen. I think where I might start with questions are a couple of questions that came in just for you. Since you just presented, I'll probably go back to a couple, and then what we'll do is we'll go back to some of the questions that have surfaced throughout the program and help share them around the panel. And so between now and 2:30, we'll do that. We'll have a Q&A. We'll hear some closing comments from Dr. Fortson, and then we'll conclude. So just a couple of questions for you, Karen. One question that came in was, how did you arrive at the 30 minutes for QT30, or the quality time 30?
We really were looking at a lot of different parenting programs that are out there, and tried to distill down. We had a conversation with many professionals from a number of different organizations and state agencies sitting around the table, and we asked ourselves, what is the one thing that we really would like for all parents or care providers to know that would really help children? And in thinking about some of the programs that are out there, we really sort of thought about it as, you know, this is the way that we can create a soundbite, for lack of a better word, in thinking about, you know, how many of the parenting programs that are available, really what they're about is helping people to connect to their children and to recognize what quality time actually is, that, you know, the parent and the child are looking at each other and that there are no interruptions. And, you know, so really using what we knew about basics of good parenting and putting that into a message that people could carry around with them to use when they need it.
Great, thank you. And a couple of other little things that came up. one question, and this is something that we can follow up with you and include in any of the resources, presentations, and materials that we supply to those who participated today. Someone just wrote in expressing some interest in citations and more about the Richard Reeves research that you looked at, so we can follow up with you about that.
Absolutely.
And then there was another question that I thought could probably be covered quickly too. There was a curiosity about where Head Start kind of fits into that slide you presented on kind of like that more comprehensive picture of Delaware's family support system. So if you could just add a little bit about where Head Start fits into that picture.
Sure. And as I said, when I provided this particular diagram, I wanted to keep it as simple as possible. Head Start would certainly be something that would be considered quality child care. And we are very involved with our early Head Start providers as well because of their home visiting component. So they're considered one of the home visiting services that we have centralized. Parents as Teachers, Early Head Start, Nurse-Family Partnership, and Healthy Families America. So they are definitely a part of the family and would definitely be considered, I guess they would be in that box with quality child care.
Great, thank you for that clarification. So in the next, we have about 10 minutes or so for some Q&A, and I will bring back up some questions that have come up before while others still continue to check questions in, and I appreciate your doing that. This question, I'll start with a question for Beverly Fortson. I think there was a question that came up earlier about whether you could provide a little bit more information on the overall Essentials for Childhood work at CDC.
Sure. So as I mentioned earlier in my portion of the presentation, our framework for all of our child maltreatment work is Essentials for Childhood, and it had those 4 goal areas that I mentioned. One of the things that we're doing is we're currently funding 5 states. Massachusetts mentioned that they're one of them. And we're providing training and technical assistance to those 5 funded states, but also to any state that is interested in participating. And I think at present there are about 20 states who are not funded, but who are still participating in this work. And so this particular initiative really, so the 5 funded states are California, Colorado, Massachusetts, North Carolina, and Washington. It's a 5-year initiative. It's currently in year 1, which was primarily a planning year, about to go into year 2, I believe. And really the goal is to focus on health equity as part of this initiative, work in all 4 of the goal areas, use a collective impact process, and really focus on creating the context that supports safe, stable, nurturing relationships and environments. Individuals who want to be part of the initiative, and particularly the funded states, are required to partner with their state health departments, their core injury program, CB-CAP lead agency, and at least one national prevention organization like Prevent Child Abuse America, Children's Trust Funds, and partner with businesses and other non-traditional partners like media. So a very exciting initiative that we have ongoing that will hopefully get us some useful information about using this framework and some lessons learned from the states that are being funded and those that are not funded as well.
Thank you. And while I have you in the spotlight, I might point another question in your direction.
Sure.
If people are wondering about the use of the Essentials resources that you're sharing and about, can people create online courses with this information? Can folks who, take the Essentials resources that you're presenting and tailor them for use within their own programs? Is there anything special they need to do? I know that there are questions already about how to go ahead and take this material and thinking about, having it supplement their current programming.
Mm-hmm. I think that was really what the purpose of today's webinar was really about. So how can you take this resource that we've developed and use it in your own work? How can you use it in the home visiting programs that you're doing? We heard one of our state examples, Massachusetts, talk about having computers available and using it within their home visiting programs, using it as part of other curricula. I think somebody else mentioned using it with the PALS program. And I think our thought in this is that it's not meant to take the place of things currently being done. And it's probably not for those who are most at risk either. I think for those who are most at risk, we're going to have to think about other strategies of getting the information to those folks and making sure that we continue those individual one-on-one interactions with them. And also, I don't see a problem with taking the information that's included and using it in the WIC programs and sharing it with your child's daycare and encouraging your child's daycare workers to make sure that they are using the information that's provided. I think one of the things that we always want to make sure we're doing is evaluating what we're doing. And so in what we've developed online, we're going to be evaluating that. And as people make changes and modifications, trying to evaluate that as well. So we feel like the information is good information for parents to know. It has a strong evidence base, a 30-year evidence base. But we want to make sure that when we take it and put it in different formats, that it's still having the same effects that it had in those initial, in the initial research on them.
Thank you. And it seems that you kind of started to answer another question that came up in the chat, and so I'm going to just share the question and then ask you to add, because this to me speaks to what you were saying about, how these tools and resources fit into a continuum of programming for parents, and where there might be more intensified need, what they add to, and how to, look for other supplemental approaches. And I think that's what this question is getting to. The question kind of speaks to a comment about how the tools seem very valuable for parents who are in a position to incorporate the information into practice. And so this participant was curious how to best support skill building in parents who have executive function challenges or have very chaotic lives, who are at most risk for parenting issues, for child maltreatment. And maybe I'd ask you first to add to that, Beverly, and then invite our other speakers to add if they'd like to.
I think this is a great question, and definitely something that we're continually thinking about at CDC and in the work that we do. I think one of the things that our Essentials for Childhood Initiative is trying to do is to address health equity, and hopefully in addressing some of the health equity and the things that affect the lives of these individuals that we're talking about here, those who have these chaotic lives, who are at risk of ineffective parenting, child maltreatment. If we address some of the inequities that they're dealing with, then perhaps they're going to be in positions to benefit more from the parenting programs that we're putting out there and the other things that we're doing. One of the other things that we've tried to think about is we think it's likely that these people may not be going to our resource. We can continue to hope that they will. But they're also going to need more individual level services, but at least having a resource available that they can potentially go to is going to be helpful. One of the things that we're thinking about also is how to get those people to the resource, at least so that they have that information if they're not getting the one-on-one services that might be needed. We're also contemplating development of this in kiosks that can be put in waiting rooms and other places where some of these individuals may be seeking services, like in offices that provide WIC or in clinics where people go for well-child visits and those sorts of things. So I think we're just really trying to think outside of the box in terms of that respect.
Great.
So I'll let other people answer.
Hi, Lynn. This is Serena in Massachusetts, and I will say that in response to the question, that was sort of our vision for why we wanted to implement tablets in home visiting, so that home visitors would be able to share information. But because so many of the resources, whether Essentials for Childhood or One Stop Shop, the information articles have usually some active component, so a suggestion, a tip, something that the parents can then try. so that the home visitor and the participant can have an in-the-moment discussion about, why don't you try this, maybe you try it now, when I come back we can talk about it, so that there can be that coaching and modeling that happens very actively, but connecting the resources that they can view to the actions in the home visit. And then hopefully, if they're saving the particular app or the website to the participants' smartphones, because so many people have them, then that home visitor can remind, mom or dad, remember that when we looked on that site, you could go and find information, and maybe next time you try it. So that was our hope, was that it would become a tool that could lead to both information sharing and really active modeling and coaching.
Great. Thank you. And again, all of these examples are helping all of our participants. And clearly, just from even some of the few questions we've discussed, people are actively thinking about how to weave these pieces and braid these pieces together in support of parents. And so I think with this, we have a couple minutes left before it's 2:30. So before I close out the webinar, I wanted to just turn it back over to Beverly Fortson, who wanted to share some concluding thoughts for all of us today, and then I will conclude after that. So Beverly, did you want to share some last thoughts with everyone?
Sure, thank you. So I just wanted to say, as we've seen in the presentations by Massachusetts and Delaware, states are engaged in a lot of activities that really aim to engage and empower parents and to prevent child maltreatment. We encourage those of you who are listening on the phone today to promote the community norm that we all share responsibility for the well-being of children. And we believe that when your children do better, have better lives, so does everyone else's. Also promoting positive norms about parenting programs and acceptable parenting behaviors, letting everyone all parents, that it's okay not to know everything about parenting. We all have questions. We all face challenges. Every caregiver can use help at times, and we need to be able to access credible, reliable information. And when using programs in your communities, using those that have an evidence base as much as possible. We know that programs with an evidence base increase the chance that the programs the parent is participating in will actually make a difference in their lives and the lives of their children. If you're using a program that you really like that doesn't have the evidence base and you're convinced that, yes, this does improve parents' lives, try to collect some data on it. You may not have in-house capacity to do that, so look outside of your specific setting and try to find somebody to help with evaluation. Universities are often great places to find evaluation partners. And if you haven't already, I encourage you to check out the Essentials Framework and see how you can use it in preventing child maltreatment and become one of the unfunded states if you're interested in doing that. We encourage you all to use Essentials for Parenting Toddlers and Preschoolers. As I mentioned before, we have flyers and other materials you can use in disseminating information. ASTHO is going to distribute the information after the call for the Go Kit and some of the other resources that we mentioned. Thank you, Lynn.
Great. Thank you so much. And I think that just between knowing about the availability of these resources, hearing some examples in Massachusetts and Delaware about how these resources get braided into ongoing efforts in their states has really stirred up a lot of thinking in our participants about what they can do. And so for that, I'm incredibly grateful to all of our speakers, Beverly Fortson, Serena Rogers, Raina Charles, and Karen Durasmo for all that you've shared with us. I also would like to thank the National Center on Injury Prevention and Control for sponsoring this webinar. And on the screen you see we appreciate your participation. We would really appreciate your filling out the webinar evaluation once we close out. It helps us improve our programs and plans for the future. And we plan on having all of the Essentials for Childhood webinars on an archive page on www.astho.org. So you needn't fear that you missed previous ones. We'll make those available to you. And so with that, we hope everyone will use this webinar as a resource. We'll share this information with others once it's available. And I would like to thank you, and please enjoy the rest of your day.